Hello, it's Dr. Rhonda Johnson. Today's Thursday, May 19th, 2022. Today I'm talking about monkeypox. Well, folks, as of today, there are 34 cases worldwide confirmed of monkeypox, and they're in England, Canada, Portugal, Sweden, Italy, France, Belgium, and yes, in the United States. We currently have one man hospitalized in Boston, a man who traveled by car from Canada. This is the only confirmed case in the United States, but the CDC is concerned that there may be more. So why should we be concerned about monkeypox if there's only 34 cases worldwide? Well, because this is usually a rare disease and has been confined to West and Central Africa, or to people with a history of travel to that region, or people who have worked with infected monkeys. So what is it anyway? It's a serious disease caused by infection with the monkeypox virus. Now, monkeypox virus belongs to the family of viruses that includes smallpox and cowpox. So what are the disease symptoms for this? Well, it begins with fever, chills, headache, muscle aches, and exhaustion. The monkeypox causes the lymph nodes to swell, and now the incubation period can range from 5 to 21 days. Now, what's characteristic about monkeypox is the rash. The rash is quite impressive and can spread all over the body. Just Google monkeypox and you will see what it looks like. Those pox lesions are contagious. They contain live and infectious monkeypox viruses, which can be passed on to other people. Now, this illness can last for 2 to 4 weeks, which is a long time to be sick. And in Africa, monkeypox has been fatal in 1 in 10 persons who get this disease. So how is it spread? Now, much of everything I've said and will say comes from the CDC website. The CDC says the virus enters the body through broken skin, even if it's not visibly broken, the respiratory tract, or the mucous membranes, which are the eyes, the nose, and the mouth. It can also be transmitted through direct contact with body fluids, or those lesion fluids, or indirect contact with contaminated clothing and bedding. And yes, it can be transmitted through respiratory droplets, large respiratory droplets, like occur when you cough and sneeze. Now, most of the current cases have occurred in men who have had sex with men. However, I want to say loud and clearly, this virus can be spread through non-sexual contact. Now, does it come from monkeys, you may want to know? According to the CDC, the natural reservoir of this virus remains unknown, but African rodents and monkeys may harbor the virus. Now, the big question is, should you be worried? Well, I think it depends on who you are. If you're a doctor, nurse, first responder, you should know about this. And perhaps the people who have been in contact with those who currently have the cases, or indirect contact with their clothes or linen, they should be concerned, and they're probably getting contacted. Now, as far as the general public, now I ask you, can you really worry about anything else? We have inflation, baby formula shortage, high gas prices, COVID, flu, long COVID, inflation, war, violence. I say try not to worry, because I don't think we can worry about anything else. But to be informed is important, especially before the rumors and the misinformation get started. I say just let the doctors and the public health folks do their thing. They'll keep us posted. They know what to do. In the meantime, we just keep washing our hands and use our common sense, and know that there's a specific vaccine for this disease, and also know that it's not related to COVID, and no, it's not caused by the COVID vaccine. That's my message today. As always, my views are my own. Stay safe, folks.